Hi everyone. So this is in response to the question about the difference between schizophrenia and some of the other disorders in that section of the DSM. So first of all, we all know schizophrenia. If you look at your DSM, it's on page 99 in your DSM-5. Schizophrenia requires two or more of the following symptoms present for a significant portion of time during a 1 month period, and that those categories are delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and negative symptoms. The other key thing about schizophrenia is that the symptoms and disturbance need to have persisted for at least 6 months. So, with the schizophrenia spectrum and other psychotic disorders, you always want to know how long the symptoms have persisted because that can make the difference between what you're diagnosing, and it can have a huge difference in prognosis for the person as well, which is why we want to be careful to accurately diagnose. So schizophreniform disorder is when those psychotic symptoms last between 1 and 6 months. So it's not enough time to be diagnosed schizophrenia. Many people will resume normal lives after that, and so your prognosis may be pretty good. However, if you cross that 6 month mark, then you probably would qualify for a diagnosis of schizophrenia. So, schizoaffective means that you have the symptoms of schizophrenia plus a major mood episode. So, that's either a depressive episode or a manic episode. The key for this is that your psychotic symptoms must also occur outside the mood disturbance. If they do not occur outside the mood disturbance, then what would your diagnosis be? It would probably be that mood disorder with psychotic features, right? So we can add the specifier psychotic features or with psychotic features to our mood disorder diagnoses, okay? Again, those have a much better prognosis when it's just a psychotic feature of a mood episode. And so we want to know, do the symptoms of schizophrenia, do those psychotic symptoms occur outside the mood disturbance as well? Because then we might be looking at schizoaffective, and for that the prognosis is going to be similar to people with schizophrenia. So it's going to be a pretty poor prognosis. Think about it, they have schizophrenia as well as a mood disorder, so it's going to be really hard for them to come up to a level of functioning that's within normal limits, okay? So then we have brief psychotic disorder, which is when those symptoms last less than a month, okay? So this is the briefest duration. Typically, it's a response to stress or trauma. And so, again, you can have a really good prognosis with this. This you really want to look and see if there are other symptoms of a mood disorder or PTSD or something else that might have a psychotic feature. But sometimes it may just be a brief psychotic disorder. Okay? So the biggest difference with all of those is that schizophrenia is really chronic. So most people have moderate to severe lifetime impairment, and the life expectancy is even affected. There's an increased risk for suicide, increased accident risk, and there may be greater threats to self-care and the ability to take care of oneself, take medication regularly, and things like that. So I hope that addresses the question. Let me know if you have further questions.